respected course in charge, respected major advisor, respected all professors and my colleagues. I am going to present my assignment topic, novel vaccines and futuristic vaccine, and this is under the course of advances in vaccinology, VMC 614 2+0. So I will cover under all the topics under following headings. In the novel vaccine, I will cover DNA vaccine, marker vaccine, mucosal vaccine, bacterial ghost vaccine, and virus-like particle vaccine. And in the futuristic vaccine, I will cover anti-allergic vaccine, anti-autoimmune disease vaccine, de-addiction vaccine, transplant survival and prolonging vaccine. So first of all, what is the vaccine? Any agent that will generate immunological response against any particular antigen, and it will be eliminated frequently from the body, and further the body will produce memory cells, is called as immune response, and that agent is called as a vaccine. So the vaccine during the journey of the development is again divided into the following headings, like first generation, second generation, third generation and fourth generation. Normally what we are using, that we are using first generation vaccine, that is the live attenuated vaccine and inactivated killed vaccine. So how the live attenuated vaccine and inactivated vaccines prepared? First of all, I will highlight the main points, that the live attenuated viruses and bacteria are those agents which are generally introduced in the body as a live, and they are formed in the form of passaging, in the form of cell culture techniques like that. And the inactivated vaccines, generally killed vaccines, when we are using different chemicals, different agents, different pH, and the heat treatment results the production of the inactivated vaccines. But there are some drawbacks of this vaccine, or the limitations of these vaccines, that due to the denaturation of protein, it will not provide actual type of immunity that is required, or due to when we are introducing the live virus or live bacteria, it will again become pathogenic, so it may again cause disease. So looking all that things, the scientist again discover the different type of the methods to prepare a vaccine, and out of them I am here describing the third generation vaccine. So what is the phenomena behind the attenuated vaccine and live and inactivated pathogen vaccine? The attenuated vaccines are introduced in the body, and the inactivated pathogens are introduced in the body. They will produce different type of antigens, and that particular antigens are highly immunogenic. They will provoke different immune system cells, and that cells will participate for the production of the immunity. So these are all the problems. The third one I want to describe it in detail, that this vaccine cannot differentiate the animals, that which one animal is vaccinated and which one animal is infected. And the conventional vaccine always required refrigeration, they need storage, and they need transportation, that all are should be maintained in a particular temperature. So looking all these drawbacks, now I am coming to describe in detail what is the DNA vaccines. So by reducing all that limitations, the DNA vaccine are particularly designed for animals, while we are getting the native antigen in the form of a particular protein. As we already know that the conventional vaccines having denatured protein, and that's why they are not producing a good immune response, while the DNA vaccines can produce a good immune response in the form of the production of native proteins. The DNA vaccines is prepared from pathogenic bacteria or pathogenic viruses. That DNA is removed, particular DNA that is very virulent is removed from pathogen, and that DNA will introduced in a suitable plasmid vector. And this plasmid vector is basically an expression vector, and this expression vector will be multiplied into suitable different type of expression system, like bacterial expression system, viral expression system, mammalian expression system, yeast expression system. And after the multiplication of that particular expression of the plasmids, they will cured from that different cells, and then they will be introduced into the human or animals as a vaccine. Then what the DNA will do inside of the body, they will introduced or they will transfect to the cell, and they will reach inside of the nucleus. Here these DNA express itself and produce the mRNA, and finally the protein, and that protein inserted outside of the cell membrane, and these proteins further provoke immune response in the form of endogenous antigens. So finally, introduction of the DNA vaccine will provoke different type of the immune response, like in this picture, the dendritic cell will aggravate, and they will further क्या बोलेंगे उसको, they will further process the different antigens, and express it on the MSC class second molecule and MSC class first molecule, and they will activate different type of the T cell response, like T cytotoxic cells and T helper cells. Further, these T cells will produce cytokines, and these cytokines will be responsible for the death of that particular cell. Now, in the current years, only 3 DNA vaccines are available in the market, and the first one is the West Nile DNA virus vaccine, second is the infectious hematopoietic necrotic virus, and third one is the COVID-19 vaccine, that is the ZyCoV-D, and that is approved by the FDA in India 2021. So this is the first human DNA vaccine, and these both are the only animal vaccines, animal DNA vaccines that are available. So this is the structure of that particular plasmid of DNA vaccine. There is origin of replication, then upstream of that plasmid is a eukaryotic promoter. This promoter is very strong to express the particular protein, and this is a gene of interest of a particular pathogen from which we are getting particular protein. Then at the downstream of that particular gene, we have one poly-A tail that is required when the mRNA is prepared, and when it will come out from the nucleus, and it will further protect the mRNA for the degradation, from the degradation. So there are different methods for gene delivery system, and out of them I am explaining 3 main plasmid delivery methods. First one is I think okay, the first one is the direct injection of that particular DNA vaccine into the muscle. When we are injecting into the muscle will transfected with a particular plasmid, and that muscle cell will become producing different type of antigens, and that antigen will provoke the nearby dendritic cells. These cells will express it on the MSC class second and MSC class first, and that will produce the immune response. When the dendritic cell express it on the MSC class second, the T helper cell will activated, and it will produce T helper cell 2 response, leads to production of interleukin 10, and the interleukin 10 finally activate the HMI response. While when the dendritic cell express this antigen on the MSC class 1 molecule, it will activate CD8 cytotoxic T cells, and it will again produce T helper cell 1 response, leads to production of interferon gamma, and the T cytotoxic cell response leads to cell death. The second method of introduction of that particular gene is the gene gun method, and in this gene gun method, the particular plasmid is adsorbed on the gold nanoparticles, and that gold nanoparticles will injected into the gene gun, and with the help of helium force, that is a gas that is present inside of that particular gene gun. With the help of helium gas force, the DNA will directly introduce into inside of the skin. So the gene gun method is preferred, and it is the best than the injection method, because in the injection method, the DNA or the plasmid will become in the extracellular, and it will not directly introduce or transfected itself inside of the cell. So there is a lot of damage of that particular plasmid outside of the skin and or the beneath the skin. While in the gene gun method, the plasmid will not destroyed, and a small quantity of plasmid will be required for that. Now the third technique is the electroporation. In the electroporation technique, during the injection of the DNA vaccine, a milliampere, about 50 to 1000 volts of current is or the electrode is placed at the site of muscle where the injection is given, and that electrode will produce the charges, and due to that particular charges, we know that the DNA is a negative charged molecule, and the cell will become a positive charged molecule, so it will easily takes place easily taken up by these cells. Now the current researches in the rabies DNA vaccine, so not only the humans but also in the animals, there are different researches are going on. Currently in the rabies vaccine, we preferred conventional therapy, and nowadays the conventional therapy is not worked, as we know that the rabies is very dangerous and very zoonotic disease, and it may again become, the virus will again activated, and it will again produce rabies. So we have to look forward for the production of DNA vaccine for the rabies virus. The DNA vaccine is also experimentally produced against the canine distemper virus, feline infectious immunodeficiency virus, and rabies virus. So what the injected naked DNA will do, it will introduce inside of the skin, and in the skin it will activate dendritic cells. Then these activated dendritic cells go towards the lymph nodes, and it will activate different type of T cells and B cell response. So what are the advantages of that DNA vaccine? First, the DNA is very stable, so it will resist outside of the temperature. It will not require any refrigeration like the conventional conventional vaccines required. Second, a DNA sequence can be changed easily in the laboratory, so we can manipulate the DNA sequence. So according to our manipulation, we can find out different DNA vaccines. Third one, due to the manipulation, we can shift T helper cell 1 response to T helper cell 2, or T helper cell 2 response to T helper cell 1. When we are injecting the DNA, or when we are preparing the DNA, we have to introduce certain cytokine genes that will provoke different cytokines like GM-CSF, interferon gamma, interleukin 2, and interleukin 12. We can also produce DNA vaccines of those particular pathogens. We can which can be unable to generate or produce inside of the inside in the laboratory, or which are very dangerous to handle. So on particularly these pathogens can also be prepared as a vaccine. There is no risk of infection in handling of that particular DNA viruses, DNA bacteria, and antigen presentation by the MSC class 1 and MSC class 2 molecules. So it will express on both MSC class 1 and MSC class 2 molecule. Easily phagocytosed by the APC, continued production of antigen for a long time. So there is no boost up is required like in the conventional vaccine. We have to boost up the second with the second dose. Now comes to the limitations of DNA vaccine. Induction of autoimmune response against the anti-DNA antibodies is there. Second, induction of immunological tolerance. The expression of the antigen in the host may lead to specific non-responsiveness of antigen. Sometimes that particular DNA is introduced inside of the cell, and it will produce a tolerance. Then limited to only protein immunogen, so the DNA can only express the proteins, so it will not work on the different carbohydrates or lipids. Risk of affecting cell growth, and low immunogenicity due to low transfection rate. As we already know, the transfection rate is very low, that is about 1 to 5%, so it will require large amount of DNA, and 95% of DNA will be destroyed when injected. Expression of protein on the cell surface getting late due to low process of transcription and translation cycle. Experimentally takes about 2 months. So when we are injecting that particular DNA vaccine, it will express and it will produce immunity after 2 months. So it will again a limitation. So this is the second nucleic acid vaccine, and this is the RNA vaccine. The unlike as we know, the DNA vaccine is to be uh, essentially introduced inside of the nucleus. So this limitation is not with the RNA vaccine. The RNA vaccine is if not introduced inside of the nucleus, it will works. कैसे बोलेंगे यार, ऐसे बोलेंगे? हाँ अच्छा बोल रहे, अच्छा बोल रहा हूँ, नेचुरल तरीके से. Okay, so there is a limitation in the DNA that the DNA has to be introduced inside of the nucleus, then after it will work. But it is not with the RNA vaccine. RNA vaccine, when will not go inside of the nucleus, it will work. So the RNA vaccine is good and preferred than the DNA vaccine, and it is sufficient for it to cross the cell membrane into the cytoplasm. Naked mRNA is spontaneously takes up by the many cell types and expressed within a minute. RNA is also self-adjuvanting. It is that it is a potent stimulator of interferon production. When RNA enters into the cell, it triggers protein expression. So it is again a good adjuvant, having a good adjuvant property. It will potent stimulator of interferon. So all like this. So now for transfection with the RNA, the scientists are using the different vectors, and out of them one is the alpha virus vector. And in the alpha viruses, mainly the Venezuelan encephalitis virus is used as a vector to introduce this RNA inside of the cell. So why this alpha viruses replicon is used? Because they are self-replicating. The RNA viruses require self-replication, and for that this particular replicon is required. That particular replicon is inserted at upstream and downstream of that particular RNA. After that administration of that replicon will transfect to the cell, and inside of the cell it will express itself and self-replicating and producing different type of protein. That protein will express outside of the cell surface. So as we know that the Venezuelan encephalitis virus is used as a common replicon, and with the help of this particular RNA based vaccines, the scientists are engaged in production of the swine influenza, avian influenza, foot and mouth disease, equine arthritis, porcine respiratory and reproductive syndrome, and Nipah virus vaccines. And uh, the US Department of Agriculture announced that these are the licensed vaccines for the RNA. So these vaccines are porcine epidemic diarrhea, swine influenza H3N2, and highly pathogenic avian influenza H5N2 vaccines. So these vaccines are now commercialized by the US department, and these vaccines are under experimental conditions. These are under the experiment. Now second vaccine is the marker. इतना टाइम लगा एक डीएनए वैक्सीन का भी। अब बताओ ये सब आ जाएगा क्या एक ही स्लाइड में, दो स्लाइड में?
हाँ नहीं आएगा। आप तो हो सकता है कि फिर मैडम भी आपको बोलेगी जैसे वो डीएनए का आप बताओगे, उन लोगों को तो क्या है जल्दी समझ में आ जाएगा।
हाँ
फिर वो बोलेंगे नेक्स्ट, बस बोलते हैं बीच में से। ठीक है ना, आप तो अपनी मेहनत करो, अपन ऐसा नहीं कर सकते ना कि अपन कम बनाए। ठीक है,
स्लाइड कैसी लग रही है? सुंदर लग रही है।
सुंदर है ना, ये तो हम तो यही देख रहे हैं। ये सब आपने प्रिपेयर किया है?
हाँ
ये कलर कॉम्बिनेशन,
हाँ मैंने,
ये जो पिंक ये सब ये तो लिया
नहीं ये तो फोटोग्राफ से लिया
ऊपर का ये जो
मैंने
marker है,
मैंने
हम तो यही देख रहे हैं तब से।
मैंने बनाया। Second is the marker vaccine. Why we are called it as a marker vaccine? Because it will differentiate the infected animals to the healthy animal. So it is a basically DIVA technique, and this DIVA technique is now implementing in different veterinary vaccines. Those vaccines having the potential to differentiate animals from infected to vaccinated is very essential and required, and not for the animals but also for the economic growth of the country. So what is the main principle of that particular DIVA vaccine is that during the preparation of a vaccine, when the infected animal producing different type of the antibodies, but after introduction of that particular vaccine, particular antibody is absent or will be added into the genome of the animal. So these are the different animal species having different DIVA vaccines is used, and the marker antigens are listed here. So out of them, one is the well-known DIVA vaccine, and world's first DIVA vaccine is the pseudorabies vaccine. It is also called Ezuski disease vaccine. It is having glycoprotein envelope deleted and tyrosine kinase gene deleted vaccine. And what are the advantage of marker vaccine? First, best use for disease eradication program, reduce economical losses, disease-free trade barrier, differentiated between infected and vaccinated animals, and detection of the antibody is done by ELISA is very easy. So it is very essential for a country that if they are having a large number of population, and the screening of each and every animal is required, then we can segregate those animals which are infected, and we can segregate those animals which are vaccinated. Otherwise some countries having segregation and slaughter policy, so that they will segregate and slaughter all the animals. Out of them, those animals can also be slaughtered which are not infected. So it has a heavy economic losses to that country, and to reduce that economic losses and for the welfare of the animals, it is very essential to go for the marker vaccine or DIVA vaccine. Now comes to the limitations of marker vaccine. As we know that there are different type of the DIVA vaccine is used in the veterinary field, like FMD DIVA vaccine and the IBR, any infectious bovine rhinotracheitis virus disease. So when we are introducing the DIVA vaccine, if the animal is again infected after the 4 months of the vaccination, it will become a carrier, and if it will become a carrier, it will be asymptomatic, and we cannot identify that this animal is healthy or infected. So it will act as a carrier, and it will definitely produce it will definitely transmit the disease to the other animals. So that is a very drawback of that particular vaccine. The second one is it will cannot differentiate the latent infection in the animals. So if the animal is already infected and having the latent infection, if we are introducing the diva vaccine, so it will not cure the latency. So it has a limitation that the animal may become carrier and may show latent infection and may be shedder of the vaccine, and we cannot provide sterile immunity. So what is the meaning of sterile immunity is here, that we cannot produce immunity that animal is uh, confirming that it has pathogen free. So the marker vaccine will not provide any sterile immunity. Now third one is the mucosal vaccine. Mucosal vaccine basically a delivery system, or when any vaccine is to be introduced on the mucosal surface uh, of the body. So in the animals there are different type of the mucosal system, like in the respiratory tract, animal having NALT and BALT, yani ki nasal activated lymphoid tonsils, and BALT yani ki bronchial associated lymphoid tonsils, skin having the SALT, skin associated lymphoid tonsils, and urogenital tract having VALT, that is the vaginal associated lymphoid tonsils, and in the gastrointestinal tract animal having the gastrointestinal tract associated lymphoid tonsils. So these all tonsils are associated with the mucosa, and when we introduce the vaccine on the mucosal surface, it is called as a mucosal vaccine. So how this mucosal vaccine works, when we are giving the mucosal vaccine orally, so that oral vaccine go inside of the mucosa of the gastrointestinal tract. Here when these vaccine are in the form of the microbes that will enter into the goblet cell, and in the M cell. So that particular antigen activate this M cell and transferred it from the M cell uh, inside of the blood system. Inside of the blood, this antigen activate dendritic cell, and this dendritic cell will further activate T cell and B cell and produce humoral as cell mediated immune response. The B cell will produce the antibodies, and particularly the IgA antibody will be produced in the mucosal system. So in every place of the mucosa, the main secretory antibodies is the IgA. Now what is the use of that particular mucosal vaccine is that we have to generate not only the IgA antibodies, but also we have to generate IgG antibody. Otherwise the IgA antibody will only produce the innate immune response, and this is not our goal to achieve. This is not our last goal to achieve the immunity like the innate immunity. We have to produce acquired immunity also, so it is very essential to not to produce only IgA but also produce to IgG. These are the different routes to introduce the mucosal vaccine, like we have to do oral vaccination, ocular vaccination, and intranasal vaccination. So what is the meaning of the oral vaccination when we are giving the vaccine orally? So there are different vaccines are available that has been introduced orally, and this oral vaccine is to be uh, administered in the animal with the help of drinking water, with the help of eating plants, and with the help of giving food, offering food to animals. And oral vaccination is generally given the time when the population is very high, and we cannot give orally one by one to each and every animal as a introducing orally in the mouth. So we will supply them plants, we will supply them drinking water, and with the help of that particular water and plants, they will eat it, and they will take the immunity, they will take vaccine. There are different type of ocular vaccines that has been introduced in the eye, and these vaccines are the Newcastle disease vaccine strain I2, Newcastle disease vaccine B1, that is the Lassa strain, then avian influenza disease vaccine, and Brucella abortus strain S19 vaccine. So these vaccines are available in the market, and these are given to the animals inside of the eye. Now these are the intranasal vaccination, when the vaccine is to be given in the nose. So there are different type of the vaccines are available given intranasally. So I will cover one by one. First is the oral vaccine. When the vaccine is given orally, it should be preferred that the vaccine should be live in the nature. Otherwise, when they are in the inactivated form, definitely our goal will not fulfill, because it will generally produce IgA type of antibodies, and these antibodies are secretory in nature, and they will just block the adherence of microbes. So that's why we have to go for the live vaccination, and we have to introduce live viruses and live bacteria that will definitely adhere to the cell surface, and after adherence to the cell surface, they will produce T helper cell 1 response, and that T helper cell 1 response will become producing different memory cells and effector cells, and producing CMI response. So normally uh, the vaccine, when put orally, it will flush out by the mucosa, and it will not work when the vaccine having the inactivated particles or inactivated antigens. So it is very essential that the virus should be active, or virus should be live, or bacteria should be live. Otherwise this virus or bacteria will enclosed by this mucous membrane, and that will come out by the sputum or by the nasal discharge. So it is recommended that we have to introduce live vaccine, because the live viruses or live bacteria that will attach to the surface, and that will damage to a particular cell, and due to that particular damage we will the immune system will produce the T helper cell 1 response. So there are different type of the viruses uh, on the basis of damage to particular cell. We can differentiate into the two types, like type 1, those attack the superficial villus or enterocytes, and the type 2, which infect deep enterocytes within the crypts. So on the basis of damage of that enterocytes, the viruses are classified into type 1 and type 2. And the examples of type 1 viruses are the transmissible gastroenteritis virus, porcine epidemic, diarrhea virus, and rotaviruses. In type 2, the example is the parvoviruses. So basically the mucosal vaccine will work only the type 1 type of viruses, because these viruses damages only the superficial layer of enterocytes, and the mucosal vaccine will only produce IgA type of antibody that will protect the mucosal surface or mucosal layer, and it will again protect the viruses to attach on the particular cell. So the mucosal vaccine is actually main focusing on the protection towards the type 1 type of viruses. Now I will cover into the oral vaccine is the edible vaccine, because in a large number of population, every animal cannot be vaccinated individually. So it is preferable to give them a different type of the plants. In the humans also, the uh, few plants is used by the scientist for giving vaccine. Out of them, one is a potato, and second is a banana. On that particular vaccines, the research is going on. So what is the main consequences to produce this edible vaccine? So that particular antigen having producing DNA is used as a gene, and that gene is to be transfected in the different plasmid vector, or it will be given directly into the viruses which have ability to infect the plants. So these are the animal viruses, and the particular DNA is introduced inside of the plant viruses, and that plant viruses when infect the plants, definitely the interest of our particular DNA is also introduced inside of that plant, and this whole plant is either extracted or isolated, and these viruses is to be directly given to as a vaccine to the animals, or otherwise these viruses is extracted, or this plasmid is extracted from the plant, and this plant extract is to be given to the animal, or either the whole plant is to be fed to the animal. Like the same things happens with the humans. The research is going on in the banana and in the potato, where the mass propagation of that particular plant is done, and after all the processes, this particular vaccine is given orally to the human. क्या हुआ?
जैसे जाओ मैं कुछ लिखूं तब तक
Now, while giving orally to the humans, that vaccine will bind to the enterocytes, and that will provoke, or that will the antigen will enter into the M cell, and inside of the M cell it will activate the dendritic cells, and then activated dendritic cell will become proliferate and produce different type of the cytokines, and these cytokines are responsible for production of T cell and B cell. Here the B cell producing different antibodies like IgA, and the T helper cell and T cytotoxic cells will activated, and it will produce the cytotoxic response. So these are the examples of vaccines that are under the experiment, like hepatitis B surface antigen, rabies virus glycoprotein, Norwalk virus capsid protein, E. coli heat labile enterotoxin, B subunit cholera toxin, B subunit mouse glutamate decarboxylase, and so on. In the veterinary field, there is one vaccine, that is swine transmissible gastroenteritis is used. In the veterinary field, these are the different proteins also introduced in the different plant carriers, and these are the tobacco mosaic viruses, and Spanish having the AF mosaic viruses. So these are the different carriers that are used for introduction of that particular protein. So in the veterinary field, Manhemia hemolytica is producing a leukotoxin, and that leukotoxin is recombinant with a particular type of DNA to the alpha alpha, or is absorbed on the alpha alpha and is to be given to the animal. Like in the rabies vaccine production, the pox virus acts as a delivery vehicle, and the rabies virus, Rhabdoviridae family virus, is introduced inside of the pox virus, and finally it is a oral vaccine, and it is given to the dogs, and this trademark of the oral vaccine is Raboral VRG. Like in the swine, the oral vaccine is to be given in the drinking water, and against the different different pathogens like Lawsonia intracellularis and erysipelas fixed reciprocity vaccine in the pig. And in the poultry, the Newcastle disease virus and laryngotracheitis and avian encephalomyelitis virus in the poultry. Now, in the case of dog, when they are protected from the plague, they were protected from the plague during the war of the United States, Western United States. So they will chewed candy, and in the candy they provided a vaccine that is against the plague. So this is a list of plant based vaccine in the veterinary field is used is under the experiment. So this is a list of plant-based vaccine in the medical field under the experiment. Now the next one is the intranasal vaccine when they are introduced into the nose. So in the canine, parainfluenza virus bordetella infection, in the feline bordetella bronchoseptica coronavirus, Kelsey virus infection, in the horse streptococcus equi virus, in the cattle bovine rhinotracheitis parainfluenza 3 respiratory syncytial virus, in the human poliovirus, rotavirus, salmonella typhi, vibrio cholerae, and influenza vaccine is under the experiment for the production of intranasal vaccine. In the humans, live attenuated influenza vaccine that is under the trade name of flu mist quadrivalent and influenza A, because it is having 4 type of valency of the antigens like influenza A, H1N1, दूसरा है influenza A, H3N2, and third one is the 2 influenza B viruses, and that is registered in the USA for giving intranasally. Now recently in 28th November 2022, the vaccine in COVAX vaccine is launched by Bharat Biotech against the corona, and this vaccine is also given intranasally. Now there is one vaccine in the animal is called as BioBoss Raspi. This is an intranasal vaccine, and it is given to protect bovines against respiratory disease complex. Now comes to the limitation of that mucosal vaccine. It will develop only innate immune response, and it has lacking memory, and they fade rapidly. Secondary immune response are sometimes difficult to induce on the surface, and multiple dose of vaccines may not increase the intensity of duration or the duration of the local immune response. Third, this is not caused by an intrinsic defect but occur because high level of IgA can block antigen absorption and so prevent it from reaching the antigen presenting cell and memory cell. Next, the ruminant present specific problem when considering oral vaccination, because ruminant having a large stomach, and this vaccine will become getting diluted inside of the rumen. Only act on the type 1 enteroinvasive organisms, and type 2 enteroinvasive organisms require parenteral administration. So these vaccines required some parenteral administration so that we can get the secondary immune response. Then provided mainly humoral immunity. So looking all of these limitations, the mucosal vaccine is not recommended for the secondary immunization. Now next one is the bacterial ghost as a vaccine. So bacterial ghost is basically a delivery vehicle, and it is having the adjuvanting property. It has the structure, intact structure, and not only the proteins but also having structure of LPS, peptidoglycan, and lipoproteins. So as a limitation in the DNA vaccine, that the DNA vaccine can only enhance the protection against the protein antigens, but here as a bacterial host, it has a different type of the antigens like LPS, peptidoglycan, and LPP. So how this bacterial host is prepared? These are prepared with the help of gene E, lysis gene E, that is the bacteriophage lysis gene E, and with the help of that particular E protein, it will create a pore in the bacterial host system. So it has a good adjuvant property, and it is very stable when lyophilized. Currently, this gene E lysis system is using mainly to the gram-negative bacteria, and the host platform is only prepared for by the only gram-negative bacteria. So these are the gram-negative bacteria under the research, like Salmonella typhimurium, Salmonella enteritidis, Vibrio cholerae, Lactobacterium, Cypripedi, Helicobacter pylori, Haemophilus influenzae, then Pasteurella multocida, Actinobacillus pleuropneumoniae, Brucella, and Aeromonas hydrophila. So what is the mechanism of gene E? This gene E produce expressed gene E protein. So this is the protein E, and it has two endings, N terminal and C terminal. This N terminal binds to the cell membrane, and the C terminal is inside of the cell. So during the initiation of lysis of bacterial host bacteria, that C will further move towards outside of the cell membrane, and it will block the peptidoglycan synthesis, and after that it will create a pore. So this is a pore where the different molecules or the cytoplasmic contents will escape out from the bacteria. So this is a hole that is generated inside of the bacterial cell. So how this bacterial ghost system will act as a vaccine, and how it will become useful as a carrier or as a delivery vehicle, because the LPS is particularly bind to the TLR4 system that is on the APC, and it will produce two type of the response. It will activate intracellular cell signaling system like MYD88, and the second one is the IRF3 system. The peptidoglycan will bind to the TLR2 system, and it will activate only MD uh, MYD88's intracellular cell signaling system, that will activate nuclear factor kappa B, and nuclear factor kappa B will synthesize different proteins. And the third one is the lipoprotein, and that lipoprotein and flagella will bind to TLR1 and TLR6, and flagella is especially bind to the TLR5, and especially that TLR5 is present in the intestinal epithelial cell surface. They will activate MYD88 system, and they will activate Janus kinase and P38 system. They will produce different type of expression of genes, leads to further production of different cytokines. These cytokines are responsible for inflammation, and results production of different B cell and T cell. So when the bacterial host platform activate different type of the cells, and that will produce different T cell and B cells, and B cell will produce the antibodies, and T cell will act as a cytotoxic in nature. So how the vaccine is to be delivered with the BG based system? There are four mechanisms by which the BG based system is used. First, when the vaccine is adsorbed inside of the periplasma of the bacterial host. In the second picture, we are showing that the vaccine is inside of the cavity of the bacterial host. Third one is when the antigen is streptavidin coated, and the BG platform is biotinylated. So streptavidin biotinylation is used in this mechanism. Fourth one, when the capsule is inserted outside of the lid, so that the vaccine is not come out. And the next one is again streptavidin biotinylated coated antigen is used as a delivery vehicle. Now this BG based vaccine is to be given either ocularly, either orally, either given by nasal delivery, or either given as an injection preparation. So these are different research are going on in different plasmids having different content of the DNA, and these are different strains of bacteria is used for the production of a particular vaccine. And here in the animal as well as the human model, different antigen presenting cells are used as, to provoke the immune response in the animal and in the human. Now comes to the advantages of bacterial host delivery system. First, having ability to colonize and target tissue leads to targeted delivery of particular drug, particular vaccine, or particular nanoparticle to a particular site. So second is it has a good immunogenic nature. Then third one is a good adjuvant. It will not only provide HMI but also produce a CMI response. Now, what are the limitations of that BG delivery system? First, the plasmid are not applicable to all gram-negative bacteria because all gram-negative bacteria cannot engulf that particular plasmid. So the plasmid can only inserted in a few cases of gram-negative bacteria, and during the cell division of that gram-negative bacteria, the plasmid is not equally transmit to each and every bacteria, so that the plasmid is not cured from each and every cell of the gram-negative bacteria. The second one is during the production of plasmid in a BG system, the antibiotic resistant gene is used, and this antibiotic resistant gene is transferred laterally in the environment, and it will again provide different AMR situations. Gene other than gene E can also be used to prepare BGs. So this is again a limitation, that only gene E cannot produce pore in the gram-negative bacteria. Now the last one, vaccine. In the novel vaccine is the virus-like particle based vaccine. So it is again like a BG based vaccine system, but here we are not using bacteria, we are using viruses. And in the viruses, they have virus-like symmetry. If we are using icosahedral symmetry virus, then definitely it is having icosahedral structure. If we are using helical symmetry viruses, then the virus-like particle having the helical symmetry. It is generally used to transport the nanoparticles having 20 to 800 nanometer in the size, and so different virus-like particle vaccine platform is used for the not only for the production of plain virus-like particle, but also is used they are preparing with the help of different expression platform. They are producing not only from viruses but also from bacteria, yeast, and insect cells, from the plants, from mammalian cells, and sometimes they are also produced from different chimeric particles, and they are using different they are used for the treatment of the cancer also. So these are the different protein. So this is a list of virus-like particle-based vaccine against different cancers, and these are the main antigen in the virus-like particles. These are the cancer type. These are the main antigen, and these are actually under the preclinical phase. So these are the main virus-like particles. These are used in the different cancer conditions. Now this slide is showing virus-like particle-based vaccines in the veterinary pathogen. In the veterinary pathogen like blue tongue virus, then Newcastle disease virus, then feline coronavirus, and avian influenza virus. So these different expression system like bacterial system, then insect expression system are used, and these are the different cell lines are used, and also different bacteria are used, and these are the recombinant proteins. These are the antigen used for the production of virus-like particle-based vaccines. Now comes to the advantage of virus-like particles. Virus-like particles uh, is present in the immune system with multiple viral epitope in the correct conformation. They are composed of viral proteins. They can activate T helper cell, inducing a strong antibody response, and with the affinity maturation and generate long-lived memory cells. VPLs are highly effective immunogens. As a result, VPL are self-adjuvanting vaccine, and VPL can also use a marker vaccine and acts as a debug. So I will cover I covered these 5 topics. Now I will cover the futuristic vaccine. Under that I will cover anti-allergic vaccine, anti autoimmune disease vaccine, de-addiction vaccine, and transplant survival prolonging vaccine. So first is the anti-allergic vaccine. Actually this is not a vaccine, this is comes under the therapy, and this is mainly the chemotherapy. Sorry, that is mainly the allergen specific immunotherapy. So in that particular allergen is extracted and introduced into the body, and it will provoke T cell response and immunoglobulins, especially IgG, and that particular antibody will mask the allergen. In 2017, first clinical uh, allergen allergen immunotherapy study with the plasmid DNA vaccine is done, and in 2018 first clinical study with recombinant allergen specific human IgG antibody for passive immunization is performed. Now what is the mechanism of type 1 hypersensitivity? Like the actual allergen when introduced in the mucous membrane, definitely it will activate the dendritic cell, it will activate the T helper cell, CD4 and CD8 cell response, and there is intra lymphoid cells, lymphocytic cells too will activated, and with the help of all of these, and with the help of all the cytokines, this will act on mainly the T helper cell 2, and that T helper cell 2 will provoke the eosinophil, basophil, and uh, monocytes, and this will release the histamine and also IgE. The IgE will produced by the B cell, and that IgE will bind to the basophil, eosinophil, and monocytes. So that will degranulate, and after degranulation, that will enhances the inflammation. Now comes to the mechanism of immunotherapy, that is allergen specific immunotherapy. So due to production of this histamine, there is inflammation, and we have to stop all this inflammation. So we have to trigger from CD4 T cell to T regulatory cell. It will produce surface molecules CTLA4 and PD1. So when the allergen is given continuously in a high dose parenterally, it will produce T regulatory cell. Then T regulatory cell will produce interleukin 10, interleukin 35, and the tumor growth factor beta. So this will stop further production of T helper cell 2 response, and production of that IgE, and um, histamine release from particular cells. While it will also reduce the proliferation of B cell, and it will increase the production of B regulatory cell. So there are actually 5 types of routes for the introduction of allergen specific immunotherapy. First is a subcutaneous route, second is sublingual route, third is oral route, fourth is intralymphatic route, and fifth is the epicutaneous route. Now comes to the outcome of the allergen specific immunotherapy. So definitely when we introduce the allergen, particular allergen, it will go inside of the body. It will decrease the T helper cell 2 response, increase T regulatory cell response, increase T helper cell जो intra uh, interleukin 10, interleukin 35, then tumor growth factor beta. It will downregulate the B cell. It will diminish the IgE response, increase IgG4 response and B regulatory response. It will downregulate the MSC class second molecule, downregulate the CD80 and CD86 molecule, upregulate the interleukin 10 and tumor growth factor beta molecule. So there is a decrease in side effect, decreased duration, increase applicability, increased efficacy, and patient adherence. There is decrease in the inflammatory mediators and activation of threshold level is increased. Now second is the anti-autoimmune disease vaccine. I will cover these anti-autoimmune disease. These autoimmune disease like rheumatoid arthritis, systemic lupus erythematosus, multiple sclerosis, type 1 diabetes, and myasthenia gravis. So vaccine for rheumatoid arthritis. So first vaccine is the DNA based vaccines. In the DNA based vaccine, the T regulatory cell response will be changed because we are introducing the different cytokine genes, and it will change the response from T helper cell 1 to T helper cell 2. As we know that T helper cell 1 will increase the delay type of hypersensitivity, while the T helper cell 2 response will increase the HMI response. Second is the peptide based vaccine. Actually, the rheumatoid arthritis patient is suffering from the disease of poly um, polyarthritis and bilateral destruction of the synovial membrane uh, because of mainly two antigens. First is the citrullinated protein and second is the GPI, glucose 6 phosphate isomerase, that is the full form of the GPI. So the patient are suffering from from this particular two antigens, and the third one is the MSC second peptide complex based vaccine. So in the MSC class second peptide complex, this particular antigen is bind to the MSC class second. So the scientists changed this amino acid sequences from 259 and from 273, and they will glycosylate it, so it will reduced to adhere to the MSC class second peptide. Now next vaccine is T cell based vaccine. So T cell based vaccines, in this vaccine the autoantigen specific T cell are cloned and from the recipient, and they will removed from the body, and attenuated and inactivated form will again injecting inside of the cell. Second is the vaccines for SLA. SLA is a systemic lupus erythematosus. In this type of vaccine, the antigens are generally double-stranded DNA, nucleosomes, ribosomes, proteins, C1q. So there are different type of intracellular antigens against which the patient is suffering, and for the now comes to the vaccine production. So treatment with the nucleosomal histone peptide, that is H4 16 to 39, can suppress the autoreactivity in B cells, and T cell based vaccine, again the patient will introduce the inactivated or attenuated form of the T cell. Now next is the vaccine for the multiple sclerosis. In the multiple sclerosis, there is a demyelination of the nerve fiber. So there is a damage of the nerve fiber due to the myelin basic proteins, and PLP means proteolipoproteins, and MOG yani myelin oligodendrocyte glycoproteins. So against these the antibodies are formed, and for that we have changed this particular antigen type in the myelin basic proteins. There is change in the sequence in amino acids like 87 and 99 to 83 and 99, and in the PLP means proteolipid proteins. So in that we will change the PLP 139 to 151 peptide. Now the T cell vaccine, we introduce into the patient inactivation or attenuation of the T cells, and third is the T cell based receptor peptide vaccine. We have introduced the different soluble receptors like variable beta 5 and variable 6 receptor region, so it will bind to that particular antigen. Now next one is the DNA vaccine. Again we will introduce the cytokine chimeric vaccine, and that vaccine will uh, insert the interferon alpha, decrease the interferon alpha level, and also the DNA vaccine contain myelin basic protein producing gene, so it will introduce inside of the DNA vaccine. Now next is the vaccines for the type 1 diabetes. In the type 1 disease, the main antigen is the insulin B chain antigen, and in that particular chain we have to change the altered the amino acid sequence from B9 to 23, uh, that is altered peptide ligand, and antigen specific vaccine. So in that particular the antigen is glutamate decarboxylase, then isolate specific glucose 6 phosphatase, and chromogranin A, and isolate amyloid polyphosphate. So this antigen is given intravenously, and definitely the antibody will produce, and that antibody will act on altered antigens. Now next vaccine for the myasthenia gravis. Um, the TCR receptor based vaccine is to be given, like variable beta 5.1 TCR vaccine is given, and the peptide based vaccine. So the anti basically the acetylcholine receptor is acts as an antigen, and here the acetylcholine receptor alpha 100 and 116 amino acid will be changed, and we will change it and for the T cell, and acetylcholine receptor alpha 61 and 76 will be changed for B cell. Now third one is the de-addiction vaccine. Actually, what is the addiction? Addiction is a neuropsychological disorder characterized by persistent and intense urge to engage in certain behaviors, one of which is the use of a drug despite substantial harm and other negative consequences. So these are basically the de-addiction vaccines. These are the drugs: alcohol, nicotine, opioid, cocaine, methamphetamine, and cannabis. And these are the antidotes, like for the alcohol, uh, naltrexone, and acamprosate, and disulfiram. These drugs are approved, these vaccines are approved against the alcohol, and bupropion and varenicline is approved by the FDA against nicotine, and this vaccine is to be given with patch, spray, gums, and lozenge. And these are the vaccines against the opioid. These are methadone and buprenorphine. These are the FDA approved vaccines against the opioid, and there is no any vaccine is under research against the cocaine, methamphetamine, and cannabis. So in the India, about 9.91% of total population is addicted for the alcohol, and in the Asia, the smoking percentage in the India is about 20% population. Sorry, yes, 20% population in the world population, and in the smokers population, it is about 10% population that are addicted in the India. So what is the mechanism of de-addiction vaccine? As the vaccine, the drug, actually the drug is very small in the molecule size, so it will not bind to the antibodies present in the B cell. So what is what so the drug is not actually the immunogenic, so we have to make it first immunogenic by binding with the hapten and carrier molecule, and then after we will inject it in the human body, and then in the human body they will produce different antibodies. So when these antibodies will bind to the intravenous injection of our carrier heptin conjugated drug. Further, when the patient uh, uh, further these B antibodies will be cloned and producing a lot of antibodies in the blood. Further, when the patient will take the drug, it will crosses the blood-brain barrier. So this is a blood and this is a brain, and the drug will cross the blood-brain barrier. But when there is a production of the antibody, it will bind to the drug, and when the particle size will become large, and now it will not enter into the uh, brain. So this is all about the mechanism of anti-addiction vaccine. Now comes to the transplant survival and prolonging vaccine. So first comes to the history that Lord Ganesha is in the Hindu mythology, that the first transplantation first successful xenotransplantation in the world. Now the first successful renal transplantation is done by uh, Joseph Murray, and he got Nobel Prize in 1990. So there are three type of graft, like isograft, when the same individual is getting their own organ, or the monozygotic twins are getting their own organ, so it is called as isograft. When the animal or human is getting their own uh, organ from different species, from different human being or animal, it is called as allograft. Or when the human or animal is getting different organ from different species, it is called as xenograft. So now comes to the mechanism of graft rejection. Normally when the graft is applied over the body, the different APC will activate, and it will activate the T helper cell response. The T helper cell will activate and produce different type of the cell, like B cell, T cytotoxic cell, NK cells, and macrophages. They will produce inflammatory response, antibodies, complement, and cell mediated cytotoxicity. Further, there is apoptosis of graft cell. So to reduce this graft rejection, the doctors will suggest to give immunosuppressors, and this immunosuppressor will bind to intracellular signal molecules in the cell, and they will inhibit the production of COX-2, and so that these are the COX-2 inhibitors, and they will produce the protein, that is the annexin A1. So this annexin A1 will further increase the L-selectin shedding, decrease endothelial adherence, and decrease endothelial transmigration of the neutrophil. So these are the different cell molecules of the dendritic cell, or the biomarker of the dendritic cell, like TLR, then node-like receptors, then REG, then CD80 and 86 molecule, and MSC class first and class second molecule, and this dendritic cell will interact with the different T cell, and it will again further produce different T cells. So we have to change this mature dendritic cell response to the tolerant dendritic cell response, and this is now the basic concept of the vaccine. In the vaccine, what we are doing, that we just injecting the toll DC or tolerant DC, so it will not activate this um, T cell responses, and further there is a change in the cell types, or in the there is inflammation. So how that toll-like receptor work? So first of all, there is a induction of toll-like tolerant DC by injecting. How the toll DC is induced? So first we have to take the blood polymorph um, nuclear cells and monocytic cells, and uh, in that the CD14 monocytes is separated with the help of immunomagnetic separation, and with the help of GM-CSF and interleukin 4, we will differentiate and activate the dendritic cell, and this dendritic cell will be acted this now we introduce different drugs, different cytokines, and different genetic engineering and biological interactions leads to production of tolerant DC. So there are different protocols for the production of tolerant DC. Further, they will be identified that yes, this is a tolerant DC, and then this tolerant DC will injected again in the humans. So what the vitamin D3 will do? Vitamin D3 will show low expression of MSC class second, CD80, CD86, CD40 molecules, and it will its high secretion and expression of interleukin 10 and IDO, that is the indoleamine 2,3 dioxygenase. What the rapamycin and dexamethasone will do? These both increase the effectiveness of toll DC induction in vitro. What the polymeric nanoparticles containing ovalbumin and dex will do? They will change the DC to toll DC phenotype. Now these are two cytokines. The with the help of these cytokines, interleukin 10 will lower the expression of MSC class second, CD80, CD86, and 40 molecules, and tumor growth factor will increase the expression of programmed cell death ligand PDL1 on DC cells. Induced T cells will reduced, and there is apoptosis of the cells, and enhances the T regulatory differentiation. Now, what the genetic intervention will be occur? The genetic intervention leads to expression of interleukin 10 related genes in the DC. So we injecting the interleukin 10 related genes inside of the cell, and it will express in the DC. So what is the biological intervention? With the help of pluripotent stem cells and recombinant schistosoma, Mancini antigen leads to production of toll DC, and this toll DC will inject in the patient before transplantation, and further before 7 days of transplantation, and further it will increase the production of tumor growth factor beta and interleukin 10, and there is a production of CTLA4 T regulatory cell in the mice, leads to prolonged cardiac graft survival. So thanks for watching. This is all about the vaccines. Hope you are enjoying this topic well. I think I tried to cover myself a lot, and it may be helpful for your study purpose. So thanks again.